welcome back, viewers at home. Now, for us to understand the importance of sickle cell awareness in our country and how exactly Sickle Cell South Africa is leading the charge to provide support, education, and advocacy for those affected by this often misunderstood and underestimated condition, I am so delighted to invite my two guests, Eseza Kironde-Hall, the co-director of Sickle Cell South Africa and a warrior in the fight against sickle cell diseases. Alongside her is Solange Mela, also the co-director of Sickle Cell South Africa and SAP Human Capital Management Senior Advisor. Good evening and thank you so much for joining me tonight.
Good evening. Thank you so much for having us.
Always a pleasure. And now, just to get started on our conversation in us being more informed and more aware when it comes to all things what we think and understand around sickle cell, I'd like to find out from you if you can explain in simple terms what sickle cell disease is and how exactly it goes about affecting our bodies.
Okay. Let's start with what is sickle cell,
Mm,
right? So sickle cell basically it's a genetic condition, meaning it's something that you're born with, and it's passed on from your parents. So one of your parents, they have the gene that
mm,
actually gives you sickle cell. So basically, what it looks like is a normal person's blood cells. It's shaped as it's a circle.
yeah.
You have like a circle. But when you have sickle cell, it's like a banana shaped cell. So it prevents blood from flowing into your system, which then leads to what we know as a crisis because you've got pains in your bones because you're not getting proper flow of blood going through your system and you're getting lack of oxygen. So that's what happens when we call a crisis.
Mm,
Just I'm trying to make it brief
yeah.
so that you have just an understanding. So it's something that is genetic, comes from your parents. Your cells are not normal. It's not round like any other normal person's one. It's shaped like a banana.
Mm. And understanding that this is now quite genetic or maybe coming from that of parents, is there a way where medically through the advancement of treatment it can be treated or cured in that sense?
So there are some treatments that have come out, but firstly, I want us to highlight how we can det get the treatment quicker or
Mm,
how we can get it diagnosed. So there's newborn screening that happens. So, like when the mother's pregnant and the mother gives birth, we can actually have that. It happens in other countries, not yet in South Africa,
mm,
where they can actually say, yes, the child has sickle cell and have treatments with it. There are some treatments that have come through in America to actually help. It helps, but it doesn't really remove the disease at all. So there is stem cells. We've got numerous things that are coming by, but you never really get rid of it. It still
mm.
is there, but it's more manageable, and it's more manageable, and you can actually, I don't want to say live longer, but it can be managed.
Mm. And I think
Yeah, we
I want to
do.
direct my
Yeah,
next question to you, Iseza, as a warrior,
yeah.
fighting against sickle cell disease, is why is it oftenly overlooked or at that misunderstood by the public?
So, sickle cell disease is what sometimes we call a silent disability or a silent disease. And because of this, it has gained quite a bit of stigma. And first of all, it starts with the association of the specific populations that are affected by sickle cell disease. And it is more prevalent amongst the people of sub-Saharan African population, the Middle Easterns, Indians, and people of Mediterranean descent. So this is quite in the malaria areas, as sickle cell is a result of the body trying to protect itself from malaria. Now, because it is wrongly perceived as a condition affecting a subset of the population, it contributes to a lack of broad public interest. And in some cases, it's even neglected by the healthcare systems in the region where those populations are minorities.
Mm,
I said before that's an invisible illness. So many of unlike a lot of conditions with visible physical markers, like let's say with cancer, you might find a tumor
mm,
or even with a broken bone, you'll see there is something to diagnose it with, for the layman's eyes to see. But with sickle cell, the most debilitating aspects of it, such as chronic pain, the crises, the fatigue, the organ damage, they are invisible.
Mm,
And this leads to the public underestimating the disease's severity. The employers, educators, and even medical professionals. We have come to a point where some medical professionals will tell us that we're exaggerating how bad our pain is, how bad our symptoms are.
mm,
There's also some harmful misconceptions around sickle cell where some will confuse it for an iron deficiency,
mm,
some will think it's contagious. In some societies, they'll think it's witchcraft.
mm,
And this, because of the stigma that is put on people, it will prevent them from openly discussing their diagnosis because of the shame, being put on the sidelines of society, and this further reduces the awareness that we could have. And all of this has led to an underfunding and limited advocacy within sickle cells, the sickle cell community. So, unlike other conditions, another genetic condition similar to, I wouldn't say similar, but similar in inheritance to sickle cell is cystic fibrosis. And it affects far fewer people globally. With sickle cell, it's one of the most common genetic diseases in the world. But a disease like cystic fibrosis has received far more resources and awareness, for resources for awareness and research,
mm,
where with sickle cell disease research and funding and advocacy, we get almost nothing.
mm,
And this has led to this financial gap has directly impacted the visibility of the disease in the public sphere. So yeah, sickle cell is also quite a complex disease where it makes it harder for people to understand, so they
mm.
just do not try to understand it.
Yeah.
So yeah, this
Yeah,
has
this is quite a very, sad reality that we're living in when it comes to all things around healthcare and, a
yeah,
person's well-being, is that the most affected and excluded people, it always becomes those who are marginalized and those who do not even have proper access to healthcare. And I think it's quite sad to say that, they don't only have to worry about, surviving poverty, but they also have to survive poverty on all aspects of their life, be it healthcare, education, and so forth. And I think, Iseza,
yeah.
with that, with your permission, I want to find out from you, what was your journey like being diagnosed with sickle cell, and what has that been for you, and how have you seen the evolvement around all things administering treatment for sickle cell and, becoming or creating that safe space for those who are found to be diagnosed with sickle cell?
I think we have come quite far. I am now almost 37 years old. And when I was diagnosed with sickle cell, we had very little in terms of the different medication to treat us, the cures. So when I was young, all we had was folic acid for our day-to-day management. And now we have hydroxyurea, which works for a number of people. We have more people getting blood transfusions. We now have the cures like stem cell, genetic engineering and bone marrow transplants that are available to some people. They are quite expensive, so they're inaccessible to the poor and the marginalized. Um, and then we have discovered that now more doctors are willing to learn about sickle cell and treat sickle cell. And most importantly, a lot of doctors are now willing to listen to the sickle cell patient.
Mm,
We are not pushed away and told we're drug seekers, but they now understand that our pain is incomprehensible to some
mm,
people. Our pain needs a lot of opiates and a lot of time and a lot of patience to manage it. Where before we're quickly dismissed that, oh, the pain is in your head, or it can't be more than cancer pain. But we're now seen as people with a complex and debilitating disease that affects all areas of our lives. And as we are seeing more by society, more people are willing to come up and say, yes, I have sickle cell, but I am more than my sickle cell. They are willing to be like, I can take up spaces where I never thought I could take up space. So I have friends who are now lawyers, friends who are doctors, where we thought we could never live past the age of 18 and have these careers and have these beautiful lives. Um, I I had all sorts of dreams of having a career, but most of all, I wanted to be a mother. And back in the 90s, I was told, a mother? No one even want to marry you. How will you be a
Oh,
mother? But now I've been with my partner, my husband, for 19 years, and I have two beautiful children. I carried twins, and
wow.
life has become more than just sickle cell. I am now sickle cell does limit aspects of our lives, but we are now discovering that we are more than that.
Mhm. And that's the power of,
No.
education, research, and just discovery, because you get to
Yeah.
do better, to, be better in that sense. And I want to come back to you, Solange, and find out from you, what are some of the, because you had mentioned in terms of, and as well as he says, are some of the challenges, but I want to find out what are some of the common challenges that are more experienced by South Africans when it comes to those diagnosed with sickle cell disease.
Okay, like what's happening in South Africa is we are out there. There are people with sickle cell that are out there, but we are not known per
Mm,
se. So that's why Sickle Cell South Africa came about. We wanted to connect people so that we can fight the struggle together. And by fighting the struggle is to make sure that there's awareness about it, so that when we actually go to doctors, they actually know what to do when they have people that have sickle cell. And that's what we're fighting to do with Sickle Cell South Africa. The challenges is that the misconception of that we just want drugs. That's why
mm,
we're in pain. We're not actually in pain. So when we come together and have a huge unity, then we are able to show doctors that no, there's more than 4 or 5 people with the same thing, and this is how we need to treat them. It doesn't mean that they're drug seekers, they actually have sickle cell. What is sickle cell? Actually, sickle cell is this. How do we treat them? Then we can start having that communication with the healthcare practitioner as well, to see how best to actually start assisting people so that we can avoid misdiagnosis of the sickness, and we can also avoid making the patient be in prolonged pain that they do not have to be in. So it's all about awareness. So that's the key thing that I think that we need within South Africa. That's a challenge. There's a lot of people that don't even know that sickle cell exists in South Africa. They don't even know what it's about. So as soon as we start talking about it, it's going to be easy for us to let the healthcare professional know it is out there. We have patients that are willing to work with you and make sure that we assist in giving practices or policy of how to go about treating people like us per se. I'm like Eseza, I'm actually a 40-year-old living with sickle
wow.
cell. They thought I wouldn't make it past 21. I'm 40.
Imagine
I
that.
work. I, and I work as well, which is
Wow.
not all of us work. So there's a lot of misconception of what the disease should look like.
Mm.
And if you look at Eseza and I, we look quite healthy for people
Yes.
who actually.
And I was about to actually
So what
ask
we.
this other question to say, you mentioned that this is, I think it says I mentioned that it's a silent disability. And with that, it's
Mhm.
like for those who are still battling the understanding and, coming to terms with the fact that, yes, they are diagnosed with sickle cell and they don't feel comfortable sharing in their spaces, is there a way for us to be, proactive as the community, as a society, to ensuring that we create that safe space to say, okay, is there a way of looking at someone and saying, okay, they are someone who's suffering from or who is fighting the fight of sickle cell disease?
So in terms of physically, you won't physically see it, like we said. It's about people coming up and sharing their stories. So if a scissor keeps quiet, nobody will know that she actually has it. And somebody who's suffering and they're going through a lot of challenges on their own and giving up hope will not be able to look at a Caesar and be like, but look at her. Look how far she's come. I can also be fine. A mother who's been told their child has sickle cell, they are given all the list of negativity that the child will not even make it past 5. So that's why we are starting to raise our voice to say, look at me. I'm 40. I've lived. I'm living. I still have a purpose that I need to fulfill. So there is hope. That's why we are passionate about Sickle Cell South Africa to say we are here. We are normal people. We're not what Google says about us. We are normal, everyday people that are fulfilling their lives.
And with that, can you just share with us some of the services and programs offered by Sickle Cell South Africa in case there is a parent watching or just any individual so that they're able to refer them to saying, hey, if you need this, if you need that, keep in touch or get in touch with Sickle Cell South Africa?
Okay, so we are a support group. So
Okay.
what we're trying to do is we're trying to build a community that says, listen, we're here to support you emotionally. We're here to support you in terms of referring to the doctors that we know around your area. We're here to pair you with people within your same um, brackets in terms of the young people with the young people because they understand each other more than you can't pay me with a 40-year-old. I don't know the struggle they're going through currently. So we do that. We do the whole pairing of people that are going through the same conditions or same circumstances so that they can assist each other, talk to each other through everything. We actually share a lot about treatments. Eseza will come back and say, listen, there's this new thing. I've tried it for 10 days. Don't you want to try it? My doctor prescribed it. Then I'm able to also tell my doctor, did you know there's this? Can we try that out? So now there's more information in a sense of you've got a platform where you can ask people, this is what's happening to me. Is that normal? What else can we do about it? So there's people that you can refer to. So those are the type of services that we are creating. And we're also fighting to create awareness so that everybody, hopefully one day, everybody in South Africa will be able to say, yes, I know what sickle cell is.
Yeah, that would be lovely. And unfortunately, beautiful ladies, we've had an interesting conversation, and I would love for us to continue, addressing some of the misconception and the discrimination that comes with it. But unfortunately, we are out of time. In the less than 2 minutes that we have, I'd like for you to just share a message to our viewers at home regarding all things, our conversation, most importantly, and also what you would like to leave them with in terms of understanding awareness and raising that awareness around sickle cell disease.
So I think what I'd love to leave with my community, our sickle cell community, and those who support us, those who might join our community, is that with sickle cell, you are not alone. There are a lot of us out there. We all have a purpose, we all have a voice, and we all have a life worth living. You are more than your diagnosis. You are your dreams. You are a future worth living. Do not hide, do not let the sickle cell let you hide yourself away. Speak out, get the support. Your family and your friends want to be there for you. Do not isolate yourself because of sickle cell disease. And join us, join our support group, join our Sickle Cell South Africa support group. We're here for you. We are on Instagram, we're on Facebook at Sickle Cell South Africa, and we will add you to our family and help you um, on this journey that we're all on. It is scary, it is a burden, but you are strong enough to live it.
And to you, Solange?
Just to add to a Caesar, we must remember something. And it's something that's key that I want to make sure that we all understand is that everybody is born with a purpose. No matter the circumstances that you're in, no matter what comes your way, there's a purpose that you still need to fulfill. Yes, you've got a condition, and we're saying Sickle Cell South Africa is here to say we're here to support you, and we're here to make sure that we can do what we can to the best of our capabilities so that you can fulfill your purpose. At the end of the day, it's about fulfilling our purpose on earth.
Ladies, thank you so much, for sharing with us your journey as well as, your insight and some of the challenges you have encountered in hopes of really giving awareness and sharing awareness with our viewers at home in terms of you can live with this condition, and as well as it's high time that we create spaces where individuals are not seen as, as you said, people were just out here looking for drugs, but people were trying to look for a sense of relief because, as you said, the pain is quite, you know, incomprehensible. But thank you so much for truly joining us and sharing with us your journey.
Thank you so much for having us.
Viewers at home,
Thank you.
that was the directors of Sickle Cell South Africa, as well as individuals who are fighting the fight against sickle cell diseases. Now, viewers at home, as you heard from them, Sickle Cell South Africa is a support group. Certainly do check them out on Facebook, connect with them, and, be part of a community, because a problem shared is a problem half solved. And with that, that's where we close it off for now. Let's head over to a net break. We'll see you just after this.